In ancient time, the word hospice referred to a place where travelers on a long journey could stop for rest and find shelter upon a difficult road. Today, hospices still provide a respite for individuals when their health status is threatened by a life-limiting condition.
Hospice is actually an extension of traditional medical care. Hospice takes over when aggressive curative care is no longer appropriate or desirable.
Once associated with just cancer patients, hospice actually provides services to any patient who suffers from a disease or condition that can no longer be treated, an individual with a prognosis that is measured in weeks and months rather than years.
In general, the feeling is that when patients are placed on hospice, they are sort of left to die, that they are terminal and nothing will be done. When in reality, hospice care is designed for aggressive symptom management that are focused to improve the patient's quality of life.
Hospice care is also designed to provide family members with support and guidance during what can be an emotional and stressful time.
It was a very difficult decision, obviously, to make, to come here knowing that this was the end, but for him, it's what's best. Being here, I've gotten incredible support from the entire staff and everyone who's been like a second family to me.
Well, we brought my dad to hospice. He had a stroke. Hospice offered us an enormous amount of support. They came in with hospital equipment. The nursing assistant comes every morning. Whatever we need, if we ask them, then they supply it.
Hospice is provided wherever a patient lives: residential homes, nursing homes, assisted living. Hospice is an interdisciplinary approach. A care plan is developed based on the unique needs of the families and patients, and services are delivered by nursing, social workers, home health aides, spiritual care professionals, and volunteers.
And when the interdisciplinary team puts something on the plan of care, it becomes a hospice service. It provides for all therapies, all durable medical equipment, and all drugs. One of the most unique services that every hospice provides is bereavement care. Taking grief and loss seriously has been a hallmark for hospice care throughout this nation.
People often think that because of the extensive care provided by hospice that it may be financially out of reach. Yet hospice care is a fully covered Medicare and Medicaid benefit and is also covered by most insurance plans.
Hospice is not based on the ability to pay, it's based on need. Hospice provides all of the necessary equipment and services to ensure comfort to both the family and the patient.
Families don't have to face the difficult decision to seek hospice care for a loved one alone. Any family member can seek guidance from the hospice staff, and the family physician is often available to guide families through the process.
Basically, when the treatment is directed towards management of symptoms rather than cure, a patient qualifies for hospice care. The way it is facilitated is through a team approach. The patient and the family should understand the hospice care. The primary care physician makes the referral, and the hospice medical director coordinates everything.
Dealing with a terminal illness is never easy. Many have found that in time of limited power with very few choices, hospice was an empowering experience, offering some feeling of control and dignity.
Well, we decided to go with hospice because even though my dad had a stroke, we knew that this was a life-changing event, and hospice was there to help us from beginning to the end.
They've been very helpful and informative and making me understand everything that's going on and that he's going through, and it's making the whole process a lot easier on me.
I volunteer because it gives me a sense of accomplishment, and it makes me feel good to be able to be there for not just the person who's at the end of his or her life, but also for the families who have already begun the grieving process.
Hospice is really a special service. Patients and families experience a great deal of physical and psychological pain at this time. Hospice is there to provide comfort and make this journey as easy as possible.
Hospice of New Jersey, a member of the American Hospice family, is a national leader in the delivery of compassionate hospice care. Offering a dynamic, interdisciplinary team of physicians, nurses, counselors, social workers, and volunteers, this dedicated organization has one goal: to bring peace and comfort to individuals in the final phase of terminal illness.
Hospice of New Jersey is a pioneer in hospice care. We've been around since 1995, servicing almost the entire state of New Jersey. Our mission is to change the way dying patients are cared for.
The promise of Hospice of New Jersey is simple: to affirm the power of choice and provide quality to every life they touch.
Most hospice care is delivered in the patient's home. However, hospice is responsible for care across all settings, and we have to be able to place a patient in an inpatient setting when acute symptoms require symptom management at a higher level. Hospice is basically about aggressive symptom management. It's taking care of the patient's symptoms when the disease can't be defeated.
Hospice of New Jersey brings together a team of professionals dedicated to not only caring for the patient, but their families as well. For many, hospice has proven to be the right decision at a very difficult time.
I would definitely recommend Hospice of New Jersey as the best place for caregiving. And they're very caring and comforting to him, and he's very happy with everyone here, and it's just making this whole process more comfortable and easier on both of us.
Hospice of New Jersey has been very good. They've been helpful from the first moment we called. They're there all the time. I can call them 24 hours a day. They take a lot of pressure off the family.
Dedicated to the idea that every patient and their family member has earned the right to quality care as well as spiritual and emotional comfort, Hospice of New Jersey has never denied care to any individual who needed services.
Hospice of New Jersey is a very special place. We never turn anyone away for care. Our staff are experts in end-of-life care, and our volunteers share in the care and the compassion that we deliver every day.
The compassionate care that Hospice of New Jersey provides allows patients and their families to make the most of their time together, easing the pain and symptoms so that patients can truly enjoy the things that are most important to them. Hospice is truly a special kind of care given by extraordinary people.